Okay, cool. So I think we've all sorry. I think we've all heard a lot about AI from the media or in movies. And when we think about AI, a lot of time, we think of it as some sort of witchcraft that somehow just make things work. Sorry about that. Did my computer just crash? Right, yeah. So in the next 15 minutes, I'm going to give a very brief introduction to AI, and I will try and demystify it and explain at a very basic level how it works. And then I would tell you guys a bit about what it can do in the clinical settings and why it matters to us who are future medical professionals. Cool. So before we go into the details, let's make sure that we are clear with some of the definitions. So you guys have probably heard of these three terms before, but you probably are not too sure what's the differences between these three terms. So artificial intelligence basically means anything we make that have features that resembles biological intelligence, which is us. And one of the most prominent features of intelligence is actually its ability to learn. So most of the efforts in AI research and development right now is focusing on machine learning. And then deep learning is a subtype of machine learning that show great promises when dealing with very complex data. And then I'll talk a bit more about deep learning later. So you might wonder, like, what the heck is machine learning, and how is it different from like a normal computer program algorithm? Well, in a very simplified way, a computer program works like this. You have an input, and then we put this input into like into the program. A computer program is basically like rules written down by the programmers that tells the computer what to do with the input data. And then a program would follow the rules and process data, do something about the data, and then spit out a solution. And the solution is also known as like prediction or inference. They all mean the same thing. And rules here basically means a program, a function, an algorithm. Again, they all mean the same thing. So so machine learning is actually the reverse of this process. In machine learning, what you give as input is actually the data and the solution. And then through some magical process, which I will explain later, you would have the rules, you have the program or the algorithm. So machine learning is actually a process where the machine made the computer program for you automatically. So one analogy is like, have you guys played a game called like it's commonly played in University of Oakham called Black Magic? I suppose you guys have probably heard of that, right? So Black Magic, right, is like a unique form of riddles. So the normal riddle is like you have a questions and then you think about a question and then you give out an answer. But Black Magic is when you have a question and you have an answer, and then you need to come up with how to map from the question to the answer, right? So normal programs are normal riddles, and machine learning is kind of like the Black Magic games. So what's going on in the magic part, right? How exactly does a machine learn? Well, it actually learns the same way as we do. So at the beginning of the machine learning process, the machine will actually make a guess. It would come up with like a very rubbish rules as like a like a baseline guess. So for example, at the start of our medical school career, we will also have quite rubbish rules. For example, like no matter what the patient have in terms of symptoms, headaches or diarrhea, in the first two PBL case, we're all our rule is basically that the patient will always have only one diagnosis, which is cancer, right? It's always cancer, no matter if it's headaches or anything. So okay, so cancer is our proposed solution, and after we've proposed this, the teacher will offer us the correct answer, and turns out that it's probably not cancer, right? And then we would compare our proposed solution with the correct one in a process called evaluation. And then we use the result of the evaluation to update our rubbish rule and makes it less rubbish, right? So in this process, we learn that, sometimes when the patient has headache and diarrhea, it's probably not cancer, it's probably something else. And then we would do this process again and again and again and again. So case after case, solutions after solutions, and evaluation after evaluations, we would gradually make less and less rubbish rules, and eventually we'll come with some rules that's actually decent. So this is how the machine learn. You would give it a lot of. Can you see my pointer? Do I have a pointer on the screen? Seems that.
I think so.
How do I get my pointer out? Okay. Anyway, okay. So yeah, we would give the machine lots of data and lots of solutions, and then we'll iterate this process over and over again, and then gradually we'll be able to learn. So once we know a bit more about how it works, we can sort of replace some of the layman term that we're using with some of the more professional machine learning linguals. So instead of data, we'll call our input features, and then we'll call the given solution labels. And then this magical process is actually called a machine learning algorithm. And then the rule that this machine learning algorithm made are called machine learning models. So machine learning algorithm is actually an algorithm that makes algorithm, right? So it's a meta algorithm, if that makes sense. Cool. So you may wonder, okay, fine, you have the models. What's next? What does it do? So the next step is for the model to make inference. And making inference is basically, let me show the animation. So making inference is basically like how the normal computer program work. You have an input which we call features now, and then the model which has learned in the process of machine learning, right? We make a prediction, we make an outcome. So at this stage, it works the same way as a normal computer algorithm. So just like us medical students have two phases in our professional life, in medical school, we are trained, right? We're in the training phase, and then after we graduate, we're practicing. So the same for machine learning. It has two phases. The first phase is training. You train a model, right? And then after the training phase, you would deploy the model, and then the model will start to make inference. Cool. And then so remember, I promised to tell you guys more about deep learning, and you may have heard of terms like neural network. Like it sounds very fancy and all that. So what is it? What's neural network? What's deep learning? Well, they are actually a type of machine learning architecture. Let me explain what it is. So say you are trying to come up with all right, you're trying to decide whether you want to revise tonight or you want to watch Netflix, right? And then you want to come up with a rule that will help you make this decision. Well, there are different types of rules that you can make. For example, you can make like flow chart that I'm showing here, right? Or alternatively, you can probably make something like this, where you have different factors to consider, and then some factors will have a heavier weighting than the others, meaning that those factors affect your decision more than the other factors, and then the weighted combinations of all these factors would determine your decision. So in the first case, the flow chart is actually called a decision tree in machine learning, and is actually one of the most commonly used. Well, they are both. They're two of the most commonly used machine learning architectures. And then a neural network is basically, you can think of it as lots of linear regression, which is the middle one. You can think of lots of linear regressions stacked together. And the reason why we stack these together is to we want to try to capture the complex nonlinear relationship between different input features. But it would be beyond the scope of this presentation to go into the details of neural network. But you can just basically think of it as lots of linear regression stacking together, right? Cool. So now we have a rough idea how machine learning work. Let's talk about what does it do. So I want to think about a medical algorithm like this that you probably see a lot day to day in medical school. So this algorithm is for upper GI bleeding. It works like if you have this, then do that. If you have that, then you do this. Right? These of algorithm massively improve efficiency and effectiveness in making clinical diagnosis. There are data that shows that actually save life and save hospital monies. But we have two problems with these algorithms. The first problem is that behind every single one of these flowchart, right, there are like tons of also different types of research, meta-analysis, double-blind trials. There are tons of research behind every single piece of flowcharts, and these good algorithms are extremely expensive and time costly to make. So it's practically impossible for us to make an algorithm for every single possible disease or conditions. And the second problem is that you can't really make an algorithm like this for complex data. And by complex data, I mean unstructured data like images or videos, audios, or medical signals like ECGs. And then when a lot of time we also have too much data that makes it unrealistic to make such algorithm with it. So for example, like have a look at this chest X-ray, right? It's taken on a patient suspected to have pneumonia due to COVID-19. But like, can you try to come up with an algorithm with how you decide that it has pneumonia or not? You probably can't, right? Because it's not, it's not like numbers. It's like picture. How can you make rules based on pictures, right? So one of the reasons why machine learning is will be so useful in healthcare in the future is precisely because it is excellent in solving these two problems. So AI, there have been numerous research that's proven that AI can learn novel insights and make automatic inference from complex data. And this means that we can not only automate what we're already doing, and this process make healthcare much more efficient. We can by doing things automatically, we can do them cheaper, we can do them faster, and we can do them at larger scales. But also, it actually enable us to do things that we were not able to do before. So, as Chris talked about in his previous presentation, with the advancement in medical technology, we have more and more types of data, and this data is booming in size. Like, think about what's happening in a clinic nowadays, right? doctor will have about 5 to 10 minutes of time to gather data from the patients. But the data the doctor was able to gather is very limited, right? It's just a snapshot of a patient's continuous timeline of health and disease. But in the future, with wearable device that can detect biometrics 24/7, 365 days a year, we have much more data, and the data can grow to a size where it's impossible for us humans to comprehend. And also, it's very hard for us to integrate all these sort of different modes of data, and it's hard for us to combine all these types of data together to make some sort of inference. So as you can see here, I listed some sort of some types of data that can potentially be inputted into a machine learning models. Because I think we have a new guest. So for example, we can have standard things like medical histories, clinical presentations, medical signals, like ECG imaging would be X-ray, that sort of things. And then the AI will be able to integrate all these data, and the model will be able to train. And then after we train the model, it will be able to make predictions for us. And some of the prediction will include like diagnosis, disease risk predictions. The AI can potentially tell us when it detects some abnormalities. You can predict prognosis. You can even design new drugs. It can recommend treatments or management plans. It can even give lifestyle advice. And actually, so as you can probably remember, the models are actually rules, or like the decision trees, or they exist in the form of the weightings in a neural networks, right? So these weightings, or like the decision trees, they actually carry informations, and we can actually directly infer insights from the model the AI learned. So let me give you guys some concrete real-world examples. So remember the chest X-ray I showed you earlier? It actually came from a paper from HKU Med. So last year, HKU Med developed a machine learning models that use chest X-ray and blood chemistry to predict whether a person have pneumonia due to COVID-19. And I think the model was quite decent. It can pick up 60 something percent of positive cases, so sensitivity 60%, and then they have a very high specificity, like 98% or so. And then similarly, so here's a paper on Nature last year. Some researchers were able to use tumor DNA that's floating in your blood. With the help of machine learning, they can actually use this information to detect early lung cancer that was otherwise not like it's at a stage where the patient don't present any symptoms. So it's otherwise very hard to detect. And then lastly, we also have something, this is very cool. So researchers at Stanford, they developed a machine learning models that can enable the patient to imagine that he or she is writing words in his mind, right? And then the machine learning model is able to translate that brain signal into actual words. And they were able to achieve a translation rate of around, I think, 90 words per minute, which is almost comparable to normal typing. So an average English speaker can type at around 110 words per minute, so it's almost there. So it's great news for a paralyzed patient. And then, so this is another example of novel insights that's discovered by AI. So it turns out that our ECG, so there's hidden informations of our potassium levels hidden in the ECG. So things like these is like impossible to be detected by human, but an AI will be able to capture these subtle details in the in the shape of the lines. And AstraZeneca is like developing a technology to read your potassium levels straight from your ECG with AI. Sorry, I think the animation goes wrong. Yeah, so this, yeah, again, it's news from last year. So a team of researchers at MIT use a machine learning models to discover an entirely brand new class of antibiotics. And lots of people now think that AI would be a great tool to have a scale of the antibiotic crisis that we're having right now. Okay, well, so I think by now I've convinced you that machine learning would be a great tool for all of us in the future. But machine learning also have lots of limitations, and it can be misused in all sorts of ways. As future medical professionals, it's obviously very important for us to know more about this powerful tool, because we need to use it anyway. Like it's not up to us, right? It's almost like computer in the 90s, right? No matter how much you hate computer in the 90s, you eventually, like everyone will eventually need to use it. So it's better for us to know it well, so that we can make the best out of it and avoid misusing it. And if you're interested in AI and you wonder how to start, I recommend you to read this fresh out of the oven introductory reviews on Nature. It's called AI in Health and Medicine. And then if you are very interested, then you can take this Stanford course on Coursera called AI in Healthcare. I think it's not free of charge, but you can always request a refund within 30 days. So it's basically free. And then I always believe that the best way to learn something is actually learn by doing. So I strongly encourage everyone to just learn Python and play with it. And yeah, that's all for today from me. And if you have any burning question, I guess you can shout right now. Okay. It seems that no one had any burning question. I guess if you have any, then you can leave it to the end. Okay. Thank you, everyone.